Hi, you're watching It's Your Health. I'm Dr. Rick Duplantis. I want to thank you for watching the program tonight. Our topic of the night is lower back pain. Lower back pain is one of the main reasons people seek to go to a doctor, secondary only to the common cold. When we talk about the lower back area, we're talking about the lumbar spine. The lumbar region of the spine consists of 5 bones that make up the lumbar spine. These are L1, L2, L3, L4, and L5 vertebral bodies. Exiting on each side of these vertebrae are the nerves, the spinal nerves. They exit from the right and the left, as you can see, at each level of the vertebral body. These nerves go on to supply the organs and muscles of the body. Okay, we're going to go on now and talk a little bit about this curve that you see here in the spine. The spine has curves, 3 curves. There's a lordotic curve, as you can see, a C-shaped curve in the lumbar spine. We have also a lordotic curve in the cervical spine under the neck as well. Now the lower back region contains muscles, these large muscles, as you can see on this screen here, as they come on layer by layer. These muscles of the back allow for movement in the trunk of the body. These muscles oftentimes become strained or sprained. Sometimes these muscles can go into spasm. Strained low back muscles are a common cause of our lower back discomfort and pain. Like I said, we have the 5 vertebrae that make up the lumbar spine, and they're connected in the back by joints. We call these facet joints. These facet joints are formed by the vertebral body above, shown here, and below. They come in the back to form a joint that's called the facet joint. These facet joints allow us to bend forward, to lean backwards, and to bend from side to side. In other words, these facet joints are very important. They give us flexibility in the lumbar spine. Now, the lower segments of the spine, the L4 and L5 and L5 and S1 region, bear the brunt of the weight of the spine, and so these areas are more prone to degeneration, arthritic processes, and also bulging disc and herniated disc occur more commonly at the L4, L5, L5, S1 regions of the lower back and the lower lumbar spine. And with that being stated, I want to go into some of the different problems that you can have in the lumbar spine. Like I said, we talked about degenerative changes, we talked about disc bulging in the lumbar spine, and herniations occur at these lower regions of the spine, shown here. As I said, the facet joints, these joints are facet joint capsules. They contain fluid, and it protects and lubricates these joints. Now these posterior paired facet joints, as you can see here, they act with the anterior disc space to create 3 joint complexes at every level of the spine. Now, in between each vertebra, we have a spinal disc, as you can see here, this clear disc material. The spinal disc is a fluid-filled sac that acts as a cushion between each level, as you can see here, of the vertebra. Due to the weight-bearing capacity of the lumbar spine, especially L4, L5, and L5, S1, the disc level in the lumbar region of the spine are most likely to herniate and degenerate, which can cause a great deal of pain in our lower back or radiating pain into the legs and even into the feet. Our spinal cord travels down from the base of the skull through a protected by the spinal canal to the level of T12, the 12th thoracic, and the L1 level, where the thoracic spine meets the lumbar spine. Is between these levels, T12 and L1. At this L1 level, an L2 segment of the lower level of the spinal cord starts to taper off and ends. The most distant bulbar part of the spinal cord is called the conus medullaris, and it is a tapering end, and it continues, and is known as a structure we call the filum terminale. These are a lot of medical and anatomical terms. Now, distal to the end of the spinal cord is a collection of nerve roots they branch out from the spinal cord and forming a horse-like tail in appearance. Hence, these nerves are called the cordia equina, which is Latin for horse's tail. These nerve roots constitute the anatomic connection between the central nervous system and the peripheral nervous system. Oftentimes, our lower back conditions may compress these nerve roots, resulting in pain that radiates into the lower extremities. When this occurs, we call this pain radicular in nature, or simply known as radiculopathy. Now let's talk about low back pain. Like I said, it's a very common reason why people seek a physician. Low back pain is extremely common. Like I said, it's a leading cause why most people will see their primary care doctor in today's society. It has been estimated that about 75% of all people will experience back pain at some time in their lives. The total cost and loss of productivity is enormous. Now, back pain is the second leading cause of absenteeism from work. And this is after the common cold, and it accounts for 15% of all sick leaves. Back injuries cause 100 million lost days of work annually, and they're a most costly injury for employees. You know, the cost of a back pain injury claim far surpasses any other claim. The average total cost per claim back in 1989 was $18,000. You can imagine what the cost is now in 2018. Time plays an important role in back pain recovery. After 52 weeks of back pain injury, disability and absenteeism, only 25% of injured workers will return to work. After 2 years of disability, the return to work ratio is 0. For 85% of back pain sufferers, the primary site of injury is a lower lumbar spine. And the good news is that the vast majority of low back pain sufferers, probably greater than 90%, will recover completely without any surgical treatment, where only 2 or 3% of the population with back pain will have a herniated disc, and only 1% have compression of a nerve root with leg symptoms. You know, chiropractic offers a very powerful, non-narcotic, non-pharmaceutical approach to back pain. Scientific study has proved that spinal manipulation, also known as the chiropractic adjustment, offers relief for low back pain sufferers. I'll come back to this point later on in my series. Chronic low back pain, failed back treating chronic low back pain is very common. It's proven refractory to non-operative management, can be very challenging to a doctor trying to treat someone with back pain. Also, for the sufferer of back pain, that's not very encouraging either. The result of previous surgical treatments are often sobering. Reoperation rates on the spine have been reported at least 6.9 to 37%. You know, this is reported of 25 to 50,000 failed back surgery syndromes cases occurring each year. That's a big number. Because of these staggering numbers, the appropriate diagnosis, efficient treatment, when indicated, are absolutely necessary when you're having back pain. Again, I say that chiropractic medicine does offer a non-surgical, non-drug solution to lower back pain. Spine surgery has not fared very well. It's all too easy to add to the chronic failed back patient population. People today are hesitant of having back surgery. They're scared of back surgery. Now, we'll come to the cause of your low back pain. There are many causes of lower back pain, from the minor low back pain strain to a herniated, all the way up to the herniated disc. Some of the common causes of back problems are disc injury. I'm talking about herniation, talking about the internal disc being disrupted, and degenerative disc disease. Disc degeneration affects about 12 million people in the United States, of which most are between the ages of 20 and 65. And this is the work population. Approximately 10% of patients with degenerative discs are candidates for some type of spinal surgery. It's my job as a doctor of chiropractic to prevent people from going to surgery. Let's talk about and go over the signs and symptoms of lower back pain now. We talked about the intervertebral disc serving as a shock absorber. These cushions that are in between each bone, the bony vertebral bodies. As we age, the disc normally undergoes a degenerative change. The disc loses its ability to hold water. This results in a decreased ability of the disc to absorb shock. And you get a narrowing between the disc spaces of the two vertebral bodies as well. This narrowing of the nerve openings also occurs, and this can cause the nerves to be pinched as they exit the spine. This narrowing of the IVFs, which is the openings that these nerves exit from, is called intervertebral foramina. It's Latin for opening, foramina. It opens up and allows these nerves to exit. But when this disc space is narrowed, it causes a decrease in the space that these nerves have to exit, and thus causing the nerve to be compressed. The result is increased disc stiffness, often accompanied by back and leg pain when this occurs. This degenerative change within the disc are universal and account for the majority of chronic lower back pain problems seen in spine clinics throughout the United States. Unfortunately, there's not a one-to-one association of disc degeneration to pain. In one study, 52% of degenerative discs were found to be in the source of patients' back pain. You can have a bulging disc in a certain percentage of the population of people, and they have no symptoms. The MRI is a tool. It's a relatively sensitive test for the detection of the degenerative changes within the intervertebral disc, but it's incapable of providing a pain association. We're talking about acute back pain and chronic back pain. There's a big difference between this acute pain and a chronic pain. Acute pain is something that you get usually because something happens to you. You might be lifting something, an object, improperly, not bending your legs, or maybe it's something you're lifting that you're incapable of actually picking up, something that weighs more than you can handle. And this can cause minor strains or injury to your lumbar spine or lower back, thus producing back pain. Now, it has been a protective function. That's why we take our hand off a stove. When we feel pain, it causes us to retract. But our chronic pain, however, does not necessarily have that kind of function, as many times this chronic pain is not the result of ongoing continuous damage or breakdown. It's a process. Degeneration occurs over time and slowly. Oftentimes, the actual cause of chronic pain cannot be discovered or located. There are some things that result in degenerative cascade which will cause chronic pain, such as degenerative disc disease, congenital spondylolisthesis, and oftentimes there is no actual anatomical defect that can account for our pain. If the source can be identified, however, as amenable with surgical correction, surgery may be able to help with chronic pain. I've had neurosurgeons tell me that, hold off having back surgery until you can hardly walk. As long as you can put up with the discomfort, don't have back surgery. Seek out non-invasive methods before and exhaust those resources before you go to back surgery. Treating back pain can come down to being trial and error for your physician sometimes, and as the patient, very frustrating. We should focus on how to manage our pain and to continue functioning with chronic pain. Sometimes injections will help patients with back pain. These steroid injections are a non-invasive method or minimal invasive method of treating back pain. Sometimes the epidural may not be all that helpful, but a sacroiliac injection may be more the source of the pain and may be more helpful to some individuals than others. It's individual. The source of your back pain and how that's to be addressed by spine specialists. There's a whole lot of different medications, from antidepressants that help mitigate pain to the newer anti-seizure type drugs that alleviate pain. Some of the drugs developed to help patients more are non-steroidal anti-inflammatory drugs, and in severe cases, maybe even narcotics on a limited basis in use. There's physical therapy too, in terms of keeping the muscles stretched and the muscles strong, keeping well conditioned, which can help manage pain and keeping the person as healthy as possible. Exercise is very good for the spine. Yoga is a very excellent exercise of stretching, and it's good for meditation, and it's very good for the spine health. Although we have pain, you don't have to react to this pain. You can choose to ignore it. That's right. You can learn to shut out the aspects of pain that we don't need to know about, that allows us to continue to function and to be more productive. It's when we allow pain in our life to take on a life of its own. When this pain starts to dominate us, we become disabled. Many people with low back pain over time develop a very high tolerance to pain. I've heard it from my patients all the time. Back in the day, many years ago, treating chronic pain, the person thought they just had to ignore it, as everyone else had back pain that they knew, and everybody just had to grin and bear this back pain. They just lived with that problem. However, in this day and age, lower back pain is treated with a wide variety of medical specialists and spine clinics, where many different healthcare professionals, from chiropractors, psychologists, neurosurgeons, pain management specialists, physical medicine doctors, treat lower back pain as a disease entity. When we engage the multidisciplinary approach to the treatment of lower back pain, it allows us to treat all different facets and all aspects of the lower back pain. It's a known fact that when we have any type of chronic pain, especially lower back pain, that prevents us from being more productive, we develop depression. When we lose something, depression is a sense of a loss. There is a need to address the patient's depression associated with their lower back pain. Treating the pain of a patient without addressing depression will result in a lack of progress in this patient. And at the same time, addressing only the pain without the emotional aspect of the pain, their depression, will not give you very much progress in treating that patient as well. I want to take a break at this time, and we'll be right back after this important message. Hi, Dr. Rick Duplantis. Today we're talking about sleep and good health. When you get a good night's sleep or rest, your body can properly control the various hormones that it produces. That affects how hungry you feel. There's a hormone called ghrelin and leptin, which are released while we sleep at night. Without them, you may feel the urge to eat more than you need, which can make you gain weight. I'm Dr. Rick Duplantis. Have a good day. Okay, you're watching It's Your Health, the second segment of the show, and I'm Dr. Rick Duplantis, and tonight's topic is lower back pain. Okay, I'd like to thank the 3D for Medical people for allowing me the use of their software to illustrate the anatomical points today that we are talking about. Okay, now let's get back into the show. Now, picking up the part at, if you're having low back pain and it's chronic, you're going to have depression. That feeling of helplessness. You might not be able to go back to work. Back pain might be very debilitating, and it actually can disable you, one way or another. And this can bring about depression. So treating the back pain, you must address depression, because without addressing both at the same time, you're not going to make progress, in treating the back pain or treating the depression by itself. I wanted to kind of recap on that. There isn't one medical specialty that is complete, have that is complete in handling or treating back pain. Not one specialty has a total handle on it. By having everybody working in concert together, you can use each other's strengths and talents. If you're working by yourself and do not communicate with other healthcare professionals, you sort of got a hammer and everyone looks like a nail type syndrome. But so you have to look at it through the eyes and be careful not to try to treat somebody for something and they really need another specialty. So physicians usually have a lot of help by calling in consults with other doctors of other specialties in order to address the needs of their particular patients. I do this all the time with my patients. Holding the doctorate of medicine and chiropractic at the same time allows me a great deal of networking and communication with the medical specialists in our community, although solely licensed and exclusively licensed as a doctor of chiropractic here in Lafayette. So if you go to see a surgeon, of course, he'll talk to you about surgery. If you talk to a chiropractor, you'll get manipulations, you'll get therapeutic modalities like exercise, you'll get moist heat, you'll get muscle stimulations, a lot of different things that the chiropractor can do to help you. Every specialist has their own expertise and their own separate toolboxes and set of tools in their toolbox, which they can help you with your back pain. If everybody works together, we can get more appropriate treatment for each patient. There isn't a cookbook, a logarithm treatment for pain, and even for something like as simple as disc herniation, there isn't a logarithm that everybody has to go through stepwise. So some patients may do perfectly fine with, spinal manipulation, with therapeutic exercises, with their chiropractic physicians. And then sometimes these patients may need help from another specialist, a pain management specialist, and maybe even as far as orthopedics. Sometimes you just can't fix some people with your specific training, and they need the help of another physician, and that's when you need to call in another doctor to help your patient. I do try to keep my patients off the operating table as much as I can. Other physicians might not respond, right away, but I think, many physicians now are starting to work together and for the welfare of the patient. And when we come to back surgery and back injuries, everybody has a different reaction and response to treatment. So there's no one thing fits every person. So again, treatments need to be directed not at what's on the MRI scan. As I was taught in medical school, you don't treat the lab. You look at the patient, you treat the patient. You direct your treatment of each patient to that individual and how they're feeling and what's going on with that person. We should treat the patient, not these diagnostic tests, in other words. Patients' needs must be met. The key that the patient gets offered different types of treatments, then they can also get the proper information they need to make the proper choices of which treatment choice is right for them. Okay, I'm going to talk about the bulging disc condition. Okay, and most cases bulging discs appear at the rear and side portions of an affected disc. This would be the back. Okay, and a lot of times these bulging discs, what they do is they put abnormal pressure upon the nerve root that exits the disc here, as we stated. This causes a range of pain types. In severe cases of bulging disc, you might experience heaviness in your legs or difficulty walking, and weakness in the legs, in other words. The common symptoms of a bulging disc would include lumbar spine pain or low back pain. You might feel numbness, might have the sensation of tingling, burning, or even weakness in your lower back. You can have weakness in the buttocks, in the legs, and even in the feet. In the cervical spine, bulging disc may result in pain, numbness, and tingling as well, and burning into the arms, hands, and sometimes, you're having head pain. In the thoracic pain, it's less common to have bulging discs in the upper back. But they do occur, and they can radiate out to the chest and to the stomach. Patients often confuse this type of thoracic pain with heart issues. If you ever have chest pain, don't hesitate and try to figure out whether it's your back or your heart. Go to the emergency room. That's the take-home message on that issue. Before reaching for more invasive treatments for a bulging disc, such as surgery, there are many non-invasive procedures and treatments that can address your bulging disc. The bulging discs are actually not a reason to have spinal surgery, actually. There are many non-invasive conservative measures to treat the bulging disc, such as chiropractic, with the use of spinal manipulation, therapeutic exercise, traction, as well as many of the modalities we have at our disposal. Low-level laser, ultrasound, muscle stimulation, the heat, also cryotherapy, and as well, like I said, therapeutic exercise. If that does not get you to the level of pain relief that you need, then you might want to use a pain management physician, but your doctor of chiropractic. I do this in my practice when I have a patient that is not responding to pain over a certain period of time, then I recommend other specialists, that may be able to help them and get them to a better level of discomfort and pain relief. Let's talk about the cause of a bulging disc now. Bulging discs occur as a result of pressure on the spinal disc. This causes the disc to become damaged, and these discs begin to break down. Remember, the discs are between each vertebral body, and they serve as shock absorbers. Now, when the disc becomes damaged and broken down, it causes compression of the nerves that exit here on both sides of the spine. When you have pressure on the nerves, you're going to have back pain. The potential causes of this increased pressure on the bulging disc is the aging process as one, and over time, day-to-day wear on the disc, which can result in a degenerative process and disease in the spine. Back or neck strain due to repetitive physical activity and overuse occurs and can cause a bulging disc. Poor spinal posture, imbalances in the musculature, or even heavy lifting, trauma as a result of a fall, as a result of a sporting event or motor vehicle accidents can cause physical injury to both the cervical and lumbar spine. There's also a genetic component to the breakdown of the disc, causing it to become a bulging disc and to cause pain. In some cases, damage only affects the inner layers of the disc, and sometimes only the outer covering of the disc is affected. There are various scenarios in a bulging disc case. Sometimes there's just wear and tear of the disc inner gel-like substance. It leaks out into the surrounding space in the spinal column. This describes a herniated disc when the total rupture of that disc material, which is contained in between the two bony vertebral bodies. And it gives us a shock absorption ability. It's a cushion, and it gives us the height and takes the pressure off the nerve roots. We're going to talk about another condition in the back. It causes a lot of back pain, and can be caused by some sort of spinal issue. And we're talking about sciatica now. And I've got a great illustration here. You're looking at the low back, okay? And we can peel off we're looking at here, we have the muscles peeled back, and this big nerve that exits here, we're talking about the sciatic nerve. As you can see, it's very thick. The term sciatica is commonly used to describe pain traveling down the distribution of this sciatic nerve that you see here as it exits here from the sacrum going down to the lower back region. Let me just bring this back up. There we go. I'll get my illustrator to help me with this model. But sciatica is more a description of the pain distribution rather than a spinal condition. Many people think of it and talk about it like it is a spinal condition. Okay, and now we've got the color, the purple colored sciatic nerve. This is kind of gives you a really bright illustration of this nerve. And the sciatic nerve is the largest nerve in the human body, number one. It's about the diameter of your finger, okay? So we can talk about the anatomy of the nerve, its origin and distribution now. The sciatic nerve fibers begin at L4, L5 in the lumbar vertebra. As you can see here, let's peel back the musculature. Okay, see, now it begins here. We're going to lower the body. There we go. And so we're seeing the sciatic nerve as it exits here and turn him around. See if we can rotate that to the front. There we go. And as you can see here, these are the sciatic nerve as it comes down here, exits off that area. The sciatic nerve fibers begin at the level of L4, L5. And on my model, it starts here, L4 and L5. These are the nerve roots here. And the sciatic nerve fibers begin between these two nerve roots and the first few segments of the sacrum, as we saw in this anatomical illustration here. The nerve fibers pass through the sciatic foramen, as shown here. These are openings in the sacrum, and just below the powerfulness muscle. Powerfulness muscle is a triangular-shaped muscle, as we see here. Let's go ahead and put on the powerfulness muscle. We'll add the muscles now. And again, and the next layer. Now we have this muscle here. I want to point to it. This is the powerfulness on both sides here of the anatomy. These powerfulness muscles, the nerve passes through the sciatic foramina and then through that muscle to the back extension of the hip and to the lower part of the gluteus maximus. Okay. The sciatic nerve then runs vertically downward into the back of the thigh, as seen in this illustration, behind the knee, and then branches into the hamstring muscles, and then into the calf, okay, and further downward even into the feet. The symptoms of sciatica usually affect only one side of the body. This pain is caused by the sciatic nerve compression, and it ranges from a sharp to burning to deep dullness, and may be accompanied by intermittent shocks of shooting pain that starts at the level of the buttock, then travels downward into the back of the thigh, or goes down the very side of the thigh and leg. Sciatica may even extend as far down below the knee and even be felt down into the feet. Now, the sciatic nerve compression can also cause numbness and tingling. Having sciatic pain can make it very painful for both sitting and standing, or even getting up for a seated position. When you have sciatica, when the sciatic nerve is being a problem for you and burning, and you feel that achy pain, that can be very painful and uncomfortable, even trying to rise from a chair and sitting down. When an individual has sciatica and he sneezes or coughs, this can increase the pain of sciatica and make it much worse. It can exacerbate this condition. The above symptoms occur when you have compression of the sciatic nerve. This produces the pain that radiates down the sciatic nerve. Permanent nerve damage is very rare in sciatica, and as well as paralysis is seldom a danger because the spinal cord ends before the first lumbar vertebra. However, there is a very serious condition called cardiac quina syndrome, which occurs, with the trunk or leg weakness, or you can have bowel or bladder incontinence. This is a very serious condition and requires immediate emergency treatment. If you've ever experienced those type of symptoms, please seek immediate medical treatment at your nearest hospital emergency room. It's very important that if you lose bladder and bowel control, with a back pain issue or trauma, and you have loss of bowel and bladder function, you need to go to the emergency room. It's an emergency. There are quite a few lower back spinal issues, disorders that cause this sciatic nerve compression. I'm going to go over them now. One is a herniated disc. The most common cause of sciatica in the lumbar spine is herniation, of course, compressing the lumbar in the lumbar region, compressing the sciatic nerve in that region. Degenerative disc disease, which is a part of the aging process, is also known to cause weakness that can be a precursor to disc herniation, believe it or not. The aging process. Lumbar spinal stenosis is a narrowing of one or more neural passages due to disc degeneration and or facet arthritis. Remember, we talked about the facets. These are the joints in the back of the spine here, shown here on this model, and the facets are created by the vertebral body above and the vertebral body below that segment come together in the back to cause this capsule, this joint we call the facet joint. Okay, degeneration of the facet joint, called facet arthropathy or hypertrophy of the facet, is seen on many MRI and CT scans. Note that the sciatic nerve may become impinged as a result of these changes mentioned. Then you have spondylolisthesis. Spondylolisthesis is when you have anterior slippage. And this often occurs at this vertebral body here, L5, when it slips forward due to a fracture. Okay, this is called spondylolisthesis. It's usually, like I said, the fifth upon the first sacral vertebra. It's a result of a stress fracture. The fracture combined with the disc space collapse, because after you see here, it will fracture. The stress fracture occurs. This vertebral body slips forward. It decreases the space for these nerves to exit, causing compression of the nerve root and giving rise to low back pain and sciatica, actually. And it can become very painful. It can become compressed or pinched at the level of the spine. Spinal tumors and infections. Now, this is a very, very rare disorder, and it can cause compression of the sciatic nerve too and cause sciatica, but this is very rare. It is important to note here that not all buttock or leg pain indicates sciatica, as there are many other structures in the spine that can cause these types of pain. Now, the sacroiliac joint, the joint between the pelvis and the sacrum, as shown on this model, if we can see it from the front, not in the back. You can turn it around for me, so we can see the posterior aspect. And this is the sacroiliac joint here. Okay, the joint between the pelvis and the sacrum. The lowest segment of the spine. Now, it is capable of causing direct pain or refer pain to the buttock region in the area, and can a sprain to the facet joints, which are connecting joints in the back part of the spine. Sometimes the tear of the disc can refer pain down into one's leg. If the buttock and leg pain are associated with any neurological symptoms of numbness or weakness, it's real sciatica and needs to be evaluated by a spine care specialist. If severe neurological deficits occur, such as I mentioned loss of bowel and bladder control issues, this is an emergency situation. It needs to be evaluated immediately in an emergency room. Do not hesitate with this condition. Now, let's talk about another condition called the powerfulness syndrome. We just talked about sciatica, and it's only natural that we move on to the condition we call the powerfulness syndrome, because in sciatica, one of the causes can be the powerfulness muscle, as shown here. Let's go ahead and put the powerfulness back on. This triangular shaped muscle here, and illustrated here, as we can see, the spinal nerve exits right underneath the powerfulness muscle. If you've ever felt pain in the hip, pain in the center of the butt, or pain down the back of the leg, you're likely suffering, and at least partially, with powerfulness syndrome. Okay, I see this condition in my clinic all the time. I meet people in the supermarket, and they talk about the leg pain, and they're describing to me powerfulness syndrome more times than any. The powerfulness is a muscle. It runs from the sacrum, and it runs through the hip bone to the trochanter. The powerfulness is stressed in anyone who does a great deal of running. It's put to the task when someone runs. The muscles in and around the gluteal region assist in three movements, such as rotation of the hip and leg balance while one foot is off the ground, and stability of the pelvic region. All of these movements are needed in runners, especially, as well in the general population for that matter. The powerfulness muscle is a prime candidate for repetitive motion injury. Repetitive motion injury occurs when a muscle is pushed or stressed perform beyond its normal level of capability when it's not given enough time to recover. Trying to perform before the body and this muscle has time to recover can cause a great deal of pain and discomfort. Given this overuse syndrome of a piriformis muscle, it begins to tighten. This tightening of the piriformis muscle manifests itself in several ways to a runner. As you can see, this muscle here overrides and lays right on top of the sciatic nerve. Can you imagine if it tightens, this muscle will give rise to putting compression upon the sciatic nerve. And you can get that sciatic nerve distribution of pain running down the back of the leg, as we just described above. The first symptom suggests piriformis syndrome would be pain in and around the outer hip. The tightness of the muscles produce increased tension between the tendon and the bone, which produces either direct discomfort and pain or an increased tension in the joint, producing a bursitis. Again, a bursitis is an inflammation of a fluid-filled sac in a joint caused by an elevation of stress and tension within that joint. Now, the second symptom suggesting a piriformis syndrome will be pain directly in the center of the buttocks. Although this is not as common as the two other symptoms, this pain can be elicited with direct compression over the belly of the buttocks area. The tight muscle is a sore muscle upon compression due to a reduced blood flow to that muscle. Simple as that. The third symptom suggesting piriformis syndrome would be the sciatic neuralgia you get, or that leg pain that sometimes, it goes into different portions of the lower leg. We have, things that sciatic can go down the back of the leg and stop at the knee, or sciatic can go all the way down into the foot. The sciatic nerve runs right through the belly of the piriformis muscle, as you can see here. Okay, let's go ahead and bring this down. Okay, and add the musculature, bring it all the way down. That's good. And let's add the piriformis back. Okay, and you see about midway in the piriformis, in the belly of the piriformis muscle, if it contracts from being overused, the sciatic nerve now becomes strangulated by this muscle that is contracting here and becomes very tight, putting that pressure on the piriformis muscle, and the piriformis starts to tighten and contract from overuse. The sciatic nerve now becomes, compressed by this tightness, producing pain and tingling numbness, which can radiate and travel down the back of the leg, the side of the thigh, even below the knee and into the foot, as we mentioned. And so recovery time, muscles need to recover after they've been used, and especially if they've been pushed to the limit. Recovery time can take as much as 24 to 48 hours to fully recover in some conditions. We can also do things to speed up the recovery. And there are ways that we can do this. The muscle is tightening due to overuse. And when we push this muscle further, it will only exacerbate this condition, making the piriformis syndrome worse and the sciatic pain much worse. This injured muscle needs to relax. Any therapy that brings an increased blood flow and blood supply to the muscle would encourage the healing to take place rapidly. The tightness in the piriformis muscle that exists acts to cause a reduction in flow of blood to the muscle, reducing the speed at which the muscle can recover. Deep tissue massage would bring oxygen-rich blood to this piriformis muscle. And it's a very powerful way of getting muscle to begin to relax by doing deep tissue massage. Okay, massage to the piriformis, sitting in a hot tub would help to relax the muscle, and it also increase blood supply to the piriformis. Would help it to loosen up a little bit. I like moist heat over dry heat because with moist heat you get deep penetration and you get increased blood flow to the area of injury. Or in this case, we have a muscle that's overused, it's tight due to lack of blood supply. We need to relax the muscle, increase the blood supply, and enhance the healing process. Another treatment for this tightness in the piriformis is to bring the blood into the region would be the use of ultrasound. Then again, treating the powerfulness syndrome due to the fact that the sciatic nerve, the hip bursitis, and tendonitis of the muscles are inflamed. You might want to use ice. Ice is a great anti-inflammatory agent. So ice applied to the piriformis region over the buttocks will be very effective in treating this inflammatory process of the piriformis muscle. You want to use ice on an inflamed muscle, 20 minutes on and 20 minutes off. Be very helpful. This can be done many times, multiple times throughout the day. Another important thing you want to talk about is stretching of the hip muscles. It should not be done though in acute pain. While you're having acute pain, it's not a time you want to do stretching, but when the pain starts to go away and diminish greatly, that's the point in time. Well, stretching, increasing flexibility, prior to becoming totally recovered from it and return to active running, you should start to stretch a little bit. I want to close and say, I'm always discouraging the use of pharmaceuticals, anti-inflammatories in some regard, because overuse of anti-inflammatories, as I've learned from medical school, cause analgesic nephropathy, a kidney condition. Can damage the tubules of the kidney. And this is a serious problem. Not only do they greatly aggravate the gastrointestinal system, and can wreak havoc in the stomach, but it leads to other problems. Like I said, the problem with the kidney. You might want to try something like a proteolytic enzyme, like bromelain. Omega-3 fatty acids are touted as a natural anti-inflammatory agent as well. And like I said, you can always use ice, to calm down inflammation in the muscle. If you're suffering from lower back pain, you might want to consider a more conservative approach, such as spinal manipulation and therapy by a doctor of chiropractic. Chiropractors give relief to millions of Americans each year. I have to speak in behalf of my own profession here. Before trying a surgical intervention, I implore you to exhaust all conservative non-invasive procedures prior to undergoing any operative procedure. I hope you have found today's program informative, and maybe it has been able to clear up a few questions you might have had about your own back pain. I hope you've gotten a better understanding of these conditions and you have a better idea how to address them and deal with them. I want to thank you for watching my show each and every week called It's Your Health. We premiere each Monday night at 8 o'clock on Channel 16, Cox Cable, and on LUS Fiber, Channel 4. I hope that you'll stay tuned now for a few of my daily health tips which will follow this show. I'm Dr. Rick Duplantis. Have a pleasant evening. Good night. Hi, Dr. Rick Duplantis here with a little information on jet lag. It's also known as time zone change syndrome. Desynchronisis occurs when people travel rapidly from east to west or from west to east in an aircraft. This time zone change causes problems in our sleep cycles, causing a circadian rhythm disorder. Symptoms of jet lag can include insomnia, irritability, and headaches. It's often thought that taking melatonin helps to improve this condition. I'm Dr. Rick Duplantis. Have a good day.